Welcome to my channel. If you're new here, I talk about perimenopause and menopause issues, also women's health in general. I'm a board certified OB-GYN and integrative medicine doctor, and today I want to talk about the menstrual cycle explained by an OB-GYN. This is really, first of all, information all women should know. Also information that really helps if you're trying to understand what's going on with you in perimenopause. You kind of need to understand the basics. So today I'm going to talk about the menstrual cycle and kind of use the whiteboard, which is something different for me, to kind of explain it because it's so much easier to understand the nuances if you can basically see what's going on. So if you love content about women's health, holistic medicine, and just overall perimenopause and menopause and want more information, please like and subscribe and put comments in the videos, and I'm happy to make videos specifically that you're looking for. So first of all, I wrote out this timeline just as 0 to 28. Remember that day 1 is always the first day of your period. So first day of legitimate bleeding. If you have like a spot, that doesn't really count. Like where you really know your period is starting, that's day 1 of your menstrual cycle. And on day 1, both hormones, estrogen and progesterone, are both very low. So this is considered the menses phase. There are 4 phases to the cycle. There is the menses, follicular, ovulation, luteal, and then we're back to menses. So menses typically last for most people somewhere on the 3 to 5 day range, at the most 7 days. So we can put that here, and let's just say that's day 7. Okay, day 14. So on day 1, or the first day of your period, estrogen begins to climb. So estrogen actually starts to rise. It goes up and peaks right before day 14, and then goes down, and then you have a second kind of peak going down to day 28. Progesterone, the other hormone made by your ovaries, remember there are 3 hormones made by your ovaries: estrogen. And estrogen, I'm using the word because there's actually 3 types of estrogen: estradiol, estriol, estrone, progesterone, and testosterone. And so progesterone does not do anything. And if you ovulate, then progesterone rises and then falls. Okay? So this is why it's really important to understand, and I'm going to put P here for progesterone and E for estrogen. This is why it's important. The reason why I'm drawing this is because when people say, should I get hormones tested or not, it's critical to know where you are on this curve. Because if you're testing hormones on day 14, your estrogen would be high, you have no progesterone, and so you need to understand that it's different than when you have progesterone that's at its peak at day 21 and not present on day 3. So it matters when your hormones are actually tested. So this again is called the menses phase, okay? This is called the follicular phase. This little 1 to 2 day window is ovulation. And then you have luteal phase, okay? So menses, follicular, ovulation, luteal phase. Ovulation is technically 24 to 48 hours, and so it's a very short phase, but technically the egg is only present to be fertilized in that 24 to 48 hour window, so it's a very small peak. So why does this happen? Oh, let me say something first about the uterus. So the uterus actually has phases as well. So the uterus actually, the whole time, because of the estrogen stimulation, it thickens, and becomes the thickest and starts to shed. So you actually have the thickest amount of the uterus right here. And then if you don't conceive, then you start shedding and you're back down to here. And this is actually a proliferative phase and a secretory phase. The uterus actually has its own phases as well. And this matters when we talk about perimenopause, which is part 2 video. I'll show you about the difference of what happens on perimenopause, because a lot of women will notice their periods are getting heavier because they start to lack progesterone. Okay, so why does this happen in general? Why do we even have these phases? Well, the reason why these things start is, and think about when you start puberty, the average age of puberty is actually 12. It's starting to to actually go down to about 11. And this happens because you have this signal that happens between your brain and your ovaries. So your brain secretes an enzyme called GnRH. I'm sorry, a hormone. I said enzyme, a hormone. And that talks to the pituitary. And the pituitary secretes FSH and LH. These are markers most people know because when they go to their doctor and say, am I in menopause, sometimes people order an FSH level. So follicle stimulating hormone, luteinizing hormone. So these are the hormones that talk to the ovaries. And this is called the HPO axis or hypothalamic-pituitary axis because it's actually hypothalamic-pituitary-ovarian axis because it is the three organs that are involved. So HPO axis. And this is when we do testing, when we're trying to understand, say you don't have a period at all and you skip your cycle, then you're wanting to understand where is it on this timeline? Is it the brain that's not telling the pituitary what to do? Is the pituitary not telling the ovaries what to do, or the ovaries just not doing it? That's kind of those tests that we do, because remember, estrogen and progesterone come from the ovaries. So does testosterone. Not all testosterone is made from the ovaries. You actually have the adrenals that contribute some testosterone as well. So this is what contributes to hair growth in menopausal women that they notice on their face, because they actually have a higher ratio of testosterone to estrogen, and then they get little hairs that drive them crazy. So this is the HPO axis, and this signaling that happens every 28 days is what creates this hormonal fluctuation. If we were to put FSH and LH, we would actually put them, LH is what actually causes the ovulation, and FSH rises and then just kind of falls down. So basically, we don't check those typically when we're looking for hormones unless we're actually looking specifically for, do you have issues with reproduction? And so then we would actually test someone's FSH or LH levels in general. So when you're testing hormones, or when your doctor tests your hormones, they typically will look for estradiol timed, so day 3 to 7 in this mark, or day 21 to 24, because they're looking to see, do you have these appropriate rises in estrogen? We rarely check it at ovulation unless you're actually undergoing fertility workup. Progesterone, we typically check day 21 to 24 because that's when actually there's a peak. There's no progesterone present in the beginning part of the cycle, so it doesn't make sense to check it. And often we will check progesterone if we're looking for ovulation. Did someone ovulate or not? So we want to know their day 21, did they peak? Because if they did not ovulate, they did not make progesterone. Because you have to make progesterone, you don't make progesterone at all until ovulation, and only if you ovulate. So the ovary has little follicles in it, and every month you're having several follicles that are being recruited to want to ovulate or leave the ovary. When they do leave the ovary and have ovulation, then the little fluid-filled cyst that's left, called a corpus luteum, produces progesterone, and therefore you know that someone actually did ovulate. So why does this matter? So for example, if we were looking for someone who, if a patient came to me and said, I haven't had my period in 3 months, can you tell me what's wrong? Typically I would order blood work on day 3 to 7, and I would be checking their FSH level, their prolactin level, which is also another hormone that comes from the pituitary. But the problem with prolactin is it blocks production. So if someone has a high prolactin level, they could potentially stop ovulating. So you check their prolactin level, you'll check their LH level, you'll check their estrogen in the form of estradiol, not progesterone because it's not present in the first half. You'll also check something called 17-OH progesterone to make sure that they're not having a lack of cycle due to an adrenal issue. And Sometimes you'll also check testosterone, not sometimes, I do check testosterone a lot because something called PCOS, when some women have higher androgen levels than estrogen levels, then they actually inhibit this process. So testosterone can suppress this whole ovulation process. So you're checking kind of this blood work to understand what is the reason. So again, is it coming from the pituitary that's not telling the ovaries what to do, or the ovaries just not producing the hormone? Where is the issue? If you're looking for things like, if you wanted to understand, is there any other cause, then you also will look at things like thyroid panel, because the thyroid hormone is also secreted from the pituitary, telling the thyroid what to do. That's TSH. And that can disrupt these hormones as well, because thyroid, TSH, has a subunit on it that looks identical to FSH and LH, and so sometimes that confuses the signals, and then people get either a shortened cycle or a prolonged cycle because of it. So understanding kind of this process helps you understand what potentially might be going on with your cycle. So if you're looking, if someone has a lack of cycle, you need to check blood work, or say they're wanting to know if they're fertile, you would check both this panel, but also wanting to know, do they have a day 21 progesterone level that's normal, so they've been ovulating. You also would check, specifically if you were looking for fertility, you might check an AMH level, which tells us how good are the ovaries, what are the reserve, or how fertile potentially is someone. So understanding the menstrual cycle helps us in general to kind of diagnose or figure out what's going on with someone's cycle. So usually when we see patients in clinic, we're trying to just get an idea, is this a normal 28-day process for someone? The normal menstrual cycle is between 21 and 35 days. So if you're below that, then that's considered an irregular cycle, or above that, like day, say 37 days long, then your cycle is irregular as well. So I hope this helps you to understand a little bit more about what the menstrual cycle is, how to ask your doctor about what's going on, or talk to them about maybe some symptoms you might be having. And stay tuned for part 2. I'm going to talk about how does this change in perimenopause and menopause. If you're interested in more women's health tips about perimenopause and menopause, or just in general, please like and subscribe and share this with your friends, because I want to make content that you really want and that you enjoy, and it matters to me that you're able to understand your own biology and your own body and advocate for yourself.